With the technology advancements, there's almost a bewildering, overwhelming set of choices for patients, and we like to simplify that for you. Cataract surgery basically is performed as a standard surgery, which is still an excellent surgery. It's one of the highest value and most successful surgeries in modern medicine. If one elects to have standard cataract surgery, then we can almost assure a great result just by performing cataract surgery. However, we found that we can enhance that and make our quality even better. That requires different types of implants and astigmatism management.
That's right. So with standard cataract surgery, we're not going to be treating astigmatism because that's not part of the covered service. So with standard cataract surgery, we tell patients to expect to wear bifocal glasses full time. We know not everyone will need that, but that's sort of an expectation so that you're not disappointed if and when you do need to wear glasses post-operatively. But if you do want to have better distance vision, for example, or better range of vision without glasses, it's very important that we take care of astigmatism. And astigmatism is poorly understood, I think, by most patients, but it has to do with the curvature of the cornea causing a blurred or smeared aspect to the vision. So when we do your cataract surgery, there are different techniques with using the laser or using different lens implants where we can counterbalance or reduce your astigmatism to give you enhanced clarity and sharpness without glasses. And that can even be more enhanced with different types of lens styles.
Right, so you have the choice of, like you said, standard lens and standard procedure, which will give you excellent vision with glasses. And then if we treat your astigmatism and we use a standard lens implant, which is covered by insurance, you'll have good distance vision or good near vision, but not both. If you wanted to be able to see well near and far in the kind of the full range of vision, then we have different options available for that as well, with multifocal lenses or what they call extended depth of focus lenses. So these are all premium lens implants that do more than the standard lens, which will give you better range of vision and better function without glasses or contacts.
So in the end, we try to decide what's best for you, what's capable, what your body's capable of, whether your cornea is too curved or too wet or not, and we really want you to be 20 happy.
So Commonwealth eye surgery has been around for about 40 years, but in that time there's been a lot of advancements, and the most recent advancement is something called a light adjustable lens, which we are proud to offer here. We've been doing that for about a year now. And with the light adjustable lens, we actually can take care of astigmatism and some range of vision after surgery. We implant the lens inside of your eye, we let you heal, and then we can use a laser to non-invasively change the shape and power of the lens. And it really allows you to be in the driver's seat and you're in control of your outcome. You tell us what you want to see. If you want to see better in the distance, we can fine tune the implant for distance. If you want more range, we can fine tune potentially one eye for an intermediate to near range. And we can really create a blend in a way that's best for you and you're really in control. The precision is really unprecedented with that technology. Again, there's more of a cost to it. It's a process, but it's something that if you're interested in that, we have the technology to deliver on it.
And another forte of that lens is many patients have had previous LASIK or radial keratotomy and they have irregular corneas. So it makes it much harder to predict what their final outcome is. If we use the light adjustable lens, we don't use the laser up front, we use the laser after the fact to customize that lens to give you the best quality vision overall.
And this treatment is actually a non-surgical treatment that's performed in the clinic, so you don't have to come back to the operating room or have another procedure. It's a very easy office procedure that can adjust your vision without having to actually do any more surgery.
A lot of patients ask about the femtosecond laser and its role in cataract surgery and in modern cataract surgery. Our practice was selected by Optomedica to have the 5th femtosecond laser system in the United States and about the 8th or 9th in the world. And that was about probably a dozen years ago, practically. Since then, we've gone through 3 more iterations of technology. And I think all of us can say, and I speak for myself certainly and for Dr. Wirtz and Dr. Paracha, that were we to undergo cataract surgery tomorrow, we would insist upon this technology.
The precision of the laser really takes cataract surgery to a different level. As good as our hands are, we still are human. And so we sort of say that the laser has image guidance that allows for incisions to be placed at very specific depths based on the imaging and also very specific curvatures. So as good as we are, we think we're among the best, it's really hard for us to compete with the precision of the laser. Haven't you found that awesome?
Right, the laser is definitely more precise It's more accurate, and it does allow for quicker visual recovery, and it assists or partners well with the premium lens implants that we were talking about with the toric lenses, multifocal lenses, and the extended depth of focus lenses.
There's actually technology that we use in the clinic that interfaces with the laser. Those two machines will talk together, and when you sit down and lay down at the laser, we actually can make sure that all of the incisions are actually paired up specifically with the thumbprint of your eye, with the iris crypts and the scleral vessels, so we can actually make sure that your outcome is as precise as possible, both with the imaging downstairs and the imaging upstairs.
It underlines one of our themes, and that was accuracy that we stressed earlier. And this is very similar to when autopilot started for aircraft. A lot of the pilots said, oh, I can fly my airplane better than an autopilot. Well, no, you can't. You know, it samples and responds 50 times a second. And despite having done 75,000 of these surgeries and trying to make an opening into the front surface of a cataract in a circular fashion, I can't compete with this machine. Its accuracy is far greater than the human hand.
So that's why we feel like it's an investment in your outcome. We've invested in the technology to provide it. And we'll talk to you more about that if you're a good candidate for laser cataract surgery. We'll talk to you about why, but it is a technology that continues to evolve and we all deeply believe in.
When we say laser cataract surgery for most patients, we can use one part or two parts or three parts of that, and we make that plan again after discussion with you and deciding what's best to optimize your vision. It is a tool, but the tool needs to be used judiciously.
That's right. And for patients who are choosing premium cataract surgery or refractive cataract surgery, we're actually going to go the extra mile and provide free excimer laser surgery like LASIK or PRK if you're a candidate after surgery. That is an extra value, but we want to stand behind the product that we provide. So, if you come to us, the last thing we want is for you to be in the community, not happy with your vision. We want to know about it, and we're going to do whatever we can to make you happy within the limits of what is safe to provide for you. So with all that in mind, we just want to thank you for choosing Commonwealth Eye Surgery. We know that you could have gone anywhere, and we count it as a high privilege to take care of you. So can't wait to see you and get to know what your visual needs are and deliver you a good outcome.